All right. Hi, everyone. My name is Tessa Boudrie, and I am the Regional Director Asia for Hope and Homes for Children. And we have come almost to the end of BICON 25. And one of the things that we would want to do is to discuss with you the key recommendations. Over these 2 days in Kuala Lumpur, care-experienced people, civil society, government officials, and donors have come together. We have started to combine the recommendations from speakers and the input from participants. As we prepare to close this BICON, this is our BICON Kuala Lumpur Declaration. The final text will appear in the BICON report that will follow the conference. Junu and the Care Experience Reference Group have already shared their recommendations, which will be reflected in the final report, of course, which are on slides here. There we go. All your thoughts and inputs have resulted in 20 points that we put on the wall this morning. Many of you have added to those since, and we have updated them, and we would like to continue to update those. I would like to invite Junu, Lama, to the stage, who will help us go through the key recommendations that have come up during these last 2 days. We've seen Junu several times on stage already, but I still would like to give her a little introduction. Junu is a care-experienced young adult from Nepal who has a bachelor's degree in business studies. She's the co-founder of Shine Together, Care Experience Network Nepal, and she is a member of the Care Leavers Reference Group. She has 8 years of lived experience in residential care, and she tirelessly advocates for the rights of care experienced and children in care. She's determined to change the hearts and minds of people through her stories and experiences. You've heard a poem of her earlier. She's using poems for advocating, and she works also as a full-time advocacy support officer in the Himalayan Innovative Society, which is one of Hope and Home's partners in Nepal. Junu, can you please come to the stage?
Thank you, Tessa. Hello, everyone, again. BICON is not just a conference. We are a movement for care reform for children in Asia. When we last met in Kathmandu in 2023, the shadow of COVID-19 was still hanging over our world. The impact of pandemic on care experienced young people in Asia and the organization that work with them was huge. Now, 2 years later, the world has become even more unstable and uncertain. Aid cuts harm children and young people and the organization that work with them. The financial pressure on the UN system weakens the mechanism set up to protect the human rights of marginalized families and children, preventing unnecessary separation and institutionalization and promoting progress towards care reform for children. But this movement will pass. Now we know that across Asia and the world, governments, regional agencies, NGOs, and donors are coming forward with new ideas, with innovations, and with action. We have heard about some of this during this BICON. The beating heart behind this progress is a growing Asian movement of care-experienced young people and the passionate people who work with them in communities across Asia. This is the same in this BICON too, where care-experienced young people are taking more of this stage, more of this space. In the room and on the stage, we have our collective strength and resilience that will change things for good. We have our collective strength and innovative approaches to keep children safe and protected in families. Let's work together to build a future where families and communities are resilient to care, protect, and nurture their children. A future where no child is separated from their families. A future where child institutions were a thing of past. We are a movement building an inclusive society of resilient families and thriving children. Let's build this world together. Let's build this work with government too. Government leadership is essential to lay the foundations and strengthen the systems in place to deliver care reform for children at scale. There has been significant national progress on care reform for children since last BICON in 2023, and at BICON, governments have shared many lessons learned. Examples where government leadership is essential, including legislation, monitoring, and gatekeeping mechanisms, national mapping and data analysis, monitoring and gatekeeping mechanisms, innovative budget planning, action planning, strengthening the social service workforce for care reform, the provision of family support to prevent family separation and facilitate family reintegration, strengthening the continuation of family-based care for children in need of alternative care, public awareness campaigns, among other topics. In this spirit of coming together, we at BICON welcome the launch of the Global Charter on Care Reform for Children that was launched at the United General Assembly in September 2025. It is a great opportunity for care reform. Here are our draft collective recommendations and calls to action from the speakers, participants at BICON 2025. The final version and more detail will be included in the final report that will follow BICON. Here are some of the collective recommendations. Accelerate care reform in Asia, prioritizing kinship care and alternative family care. This is an essential part of transforming care system and ending institutionalizations. Support children's right to meaningful participation in decisions affecting them. So they grow with confidence, not silence. Listen to those in care and those who have left care, not as tokens, but as leaders shaping policies and programs. Create direct pathways between care experienced young people and power holders. Listen to care experienced youth as decision makers, including marginalized and invisible groups. Meaningfully engage caregivers, associations, organizations of persons with disabilities, and other representative organizations from the start, and not merely for consultation or for implementation. Build better cooperation between disability and child rights across at all levels, working together more urgently to ensure progress on care reform is aligned with social model of disability. Support families, parents, and caregivers need to be provided with opportunities to develop positive parenting skills, social protection, economic empowerment, and access to mental health and psychosocial support and peer support platforms. Ensure aftercare as a right, not as a favor. Education, health, counseling, and employment support must be available to every care experienced youth. Aftercare support for young people is must for safer and stable reintegration. Enable access to mental health service while in care, while preparing to leave and after leaving, because healing is lifelong. Invest in inclusive social protection. Economic hardship is a major driver for family separation. Invest in strengthening the workforce, build the capacities and numbers of social workers and child care professionals through standardized training and peer exchange across all levels, especially at the grassroots level with a specific focus on prevention and family strengthening. Invest and ensure support for kinship carers and children in kinship care as key strategy for family strengthening, including development and strengthening of national policies, financial support, mental health, and caregiving support. Strengthen, support, and monitor foster care through appropriate legal recognition, adequate policies to operate all type of foster care services, and appropriate support for caregivers. Foster care should be further expanded with children with disabilities, refugee, migrant children, and other minority groups. Invest in enabling conditions for care reform, promote policies and innovation, pilot and innovations. Amplify philanthropy, enable regional pooled funds for child protection, and raise awareness on the importance of fundraising and philanthropy initiatives. Leverage technology and data systems to adopt digital platforms for case management to ensure efficiency, transparency, and accountability. Deepen regional collaboration, expand cross-border partnerships, consultations, and knowledge exchange to address shared challenges such as child trafficking and illegal adoption. Establish and sustain multi-stakeholder engagement, mobilize and strengthen collaboration between local communities, governments, and international partners. No one can do this alone. Strengthen the legal and policy frameworks related to care reform, streamline adoption and alternative care processes through clear, child-focused legislation. Give easy access to children without parental care and caregivers to their personal documents and records, including birth certificates and other important paperwork with the support from their local authority and others. We call on regional bodies like ASEAN and CIVAC to take action to support, promote care reform. Countries should sign a global charter on care reform for children. It is an opportunity to spark progress with government, communities, and places. We need more forums like BICON to oversee this progress. While we say family is a foundation of a society, children and young people are foundation of a nation. These collective recommendations from yesterday and today are the blueprints that shows the pathways for the care reform we all have envisioned. This should not be limited to reports or paper. It needs clearer action. Together, let us commit to transform these recommendations into real lasting changes that safeguards and ensures child rights, every child rights to grow up in safe, supportive, and loving environment where adulthood is no longer reimagining the childhood that was once lost. And protecting childhood is building the nation. Thank you.
Thank you, Junu.